Hi guys, welcome back, part two, because it's a lot of information, and now we're going to be talking again with Dr. Sharada Tripathi about hormone balancing. We're going to be talking about that bioidentical hormone replacement therapy. Let's get into it. Let's dive, because it's a lot of information, and I want you guys to get everything. So thank you again.
Thank you. Thank you again for having me.
Okay, so many people associate therapy primarily with menopause aging, but we're seeing younger individuals. And as a trainer, I gotta say this, and I'm asking this also to you. I'm seeing younger women in their 30s, in their early 40s, going through a perimenopause, and obviously menopause and postmenopause. And there's a lot of key factors going on that it's happening, and maybe they are not aware. Can you elaborate and dive into a little more about this?
Absolutely, yes. And it's very unfortunate that what you just brought in, that I treat anywhere from early 20 to late 80s, the hormone replacement. And it's kind of sad, the environment, the era that we're living right now. Absolutely, we have seen hormone imbalance in 20 years old to not only menopause. There's a lot of misconception out there, like, oh, I'm hitting a menopause now, I'm going through the hormonal imbalance and all that. But it's really, it can be started at any age, because there are several factors that affecting the lifestyle right now that we're having. Number one, stress. Stress is a big thing with the hormonal imbalance. Environmental exposure, our diet, and the other thing is chemical exposure. So all things, because of all that things, and the environment we're living right now has affecting our hormone imbalance naturally. We're losing hormone a way early age than used to. Back in the day, 50 years ago, would be different story. We're not eating a food from the vegetable garden or organic. It's not like that. We're eating food that coming from different state, country. Then we keeping in the process, so many process, putting in the refrigerator, freezer. Then we cooked after a few days, and we're cooking that food we're eating for a few days. By the time we eat, we already lost all the hormone and nutrient. So it's unfortunate in the medical, in advance, the age, modern world that we're living right now, but we're losing the hormone naturally. And yes, it's unfortunate, but I seen a hormone imbalance in a way earlier age as well.
Definitely. Could you walk us through how is it that the bioidentical hormone replacement therapy, and moving forward, I'm just going to refer it to BHRT, that's the abbreviation. How does it differ from the traditional hormone replacement therapy, and why is bioidentical aspect matters for those considering this treatment?
Absolutely. So BHRT, or bioidentical hormone replacement, is not a synthetic. So I want to make sure that it is a...
Thank you for that clarification.
Bioidentical is made from plant-based soy or mostly, and it's a purely plant-based, but that its mimic is what our body has its hormone. We all have we have a hormone, and it's mimic with what DNA we have in our body, and it works with exactly the way our hormones supposed to work in our body. This is why it's called bioidentical.
But it's interesting to hear that.
Yeah, back in the day, I think in 1900 time, they were made from horse and synthetic and all that. There are some of the injection where if they're mixing something else, it's not bioidentical. But as long as it's purely, then it will be bioidentical hormone, and it's mostly the cream and pellet version that we have bioidentical.
Got it. So with BHRT potentially affecting everything from our bone density to our mental clarity, everything regarding our functional organs and everything in general, can you go into more details about that?
Absolutely. It's an alternative medicine. So there is a hormone is our fuel. It's a chemical messenger to our body. We're naturally produce hormone, but as we age around 30, unfortunately, we as a female lose 50% of the hormone, and male they start to lose 1 to 3% after 30. So what happened is when you start to lose the hormone, the chemical messenger or happy molecule, that serotonin, melatonin, start to deprive too. And when those chemical is deprived, we're losing our hormone. That's, for example, testosterone, estrogen, all that too, we're losing at the same time. And we're not sleeping well. It's affecting our sleep. You're not able to focus. And what affect our mental. And it's not only for the mental, but it also our bone, cardiovascular, our circulation, joint. There is many more that our hormone play the role in our body.
So it's overall our body, our wellness, how our mental, everything, our emotions, all that things that.
Absolutely. So it helps when you have a hormone imbalance, you may go through lack of energy, fatigue, unable to lose weight because you're not able to lose weight. You don't have enough fuel in your body. Hormones is literally, we feel our best when our hormone in harmony. And it's really important that you get that energy. You're working out, you go out, it gives you mental strength. So that's overall, it gives you full wellness. But it's not only one system it's working, it actually gives you overall wellness to your body as well.
And when the person starts the treatment, how long or how fast will they start seeing any type of difference?
Again, this question is kind of tricky. It could be different body, different person react differently. I would say, first of all, we need again consultation, extensive history and consultation. Based on that, we do the lab draw and find out where your hormone levels are, what part you have deprived estrogen, testosterone, what's going on in your body, and based on that, I explained that there's so many options for hormone replacement. You get to choose pellet, cream, patch, troche, injection. There's so many other options you get to choose, and what good fit on them. It's really personalized again. Different, you may like pellet, the other person may like cream or injection. And based on that, once we decided, it takes typically, I would say, 2 to 4 weeks that we start to see the symptoms. But some people seen within a week, they will tell me, I actually feel great. In a week, they may see result, and some might take a longer time based on how their body take it and then work. So it's really, we all are different.
That's. I like to hear that there's like different ways. It's just not one specific pill or injection, so it's different thing, and it's going to be what's best for you. It's personalized for the person, which I like that. In response to that, for people who are thinking about it, but also they're still concerned about the potential risks versus the effects, what would you say to them to make it easy for them to make that decision?
Absolutely. And it can be it can be like people may get nervous, and there is some risks. What the hormone replacement risks would be cancer and all the other communication misconception out there too. Some of the risks are there if you already have a history of endometriosis or cancer, breast cancer, ovarian cancer. But it's really, this is why important to get the extensive history. If you do not have a history of yours or immediate family, then there is no risk, especially for the hormone is supposed to actually prevent getting a cancer. But this is why it's really important for me to get the full consultation, medical history, and then are you eligible for the hormone replacement or not, and then very closely monitoring on you. I do have a couple of ladies that doing a hormone replacement but had a history of breast cancer. Gynecologist said, do not do the hormone replacement because we're not sure what's going to happen. But she's taking that risk versus her quality of life. She wants to have a quality of life. But we're doing is closely monitoring on that. Her gynecologist is actually monitoring on her too. So there are options for people too, but most of the time it's safe. It's safe, especially you're doing the bioidentical hormone.
Definitely. For many patients that have reported improved mental health and cognitive function with this BHRT, could you explain the connection between the hormone balance and the brain function, particularly regarding memory, mood, and stress management? Because that is something that is real, that it happens to all of us. Even if you're still not even perimenopause, because I want you to mention something that when we started our conversation, you mentioned something, seeing women specifically in their 20s And that
Mm-hmm.
really hit me in their 20s. So, how can this exactly, a little more in details from the medical standpoint, their mood, their bone density, their strength, their memory function? So, how can that come together? Can you elaborate a little more on that?
Absolutely, yeah. So it's, some of them are, I would say, hereditary. I have seen some people genetically, when they're on puberty, they already had an imbalance, and they go through so many hormone replacement. It started a hormone replacement early age. I actually have some immediate family to see had been doing hormone replacement from the teenager. So some go to, that's a different story. But
Mm-hmm.
some had lose early because of their lifestyle, how their body stress, how you are doing overall in your diet, exercise, and how you're taking cortisol, how high your cortisol level, all that matter too. So it's what would do is, once we do the detailed test of the hormone panel, we will know where you at, and from there, when you replace the hormone, it's literally chemical messenger to your body. It's a fuel that give you mental strength, and also help with your, I mentioned earlier, that helps your cardiovascular, bone density, blood circulation, joint, and many more. So when you energize or synergize the hormone level, it's, you're optimizing your mental strength. You're also overall your cardiovascular getting better, and you're sleeping better, because you're, when, for example, I mentioned earlier, when you have a sleep deprived, you woke up very foggy, and like you can't
Mm-hmm.
function, you cannot concentrate the things that you're supposed to do. When you have a harmony of hormone, you're sleeping better, you have a good melatonin, you have a more serotonin. So melatonin and serotonin is actually happy molecule in our body. When you optimize those, naturally you're bringing up your hormone too. So when your hormones are balanced, your happy molecule are also balanced, and you're sleeping better, you're doing more things, you with a mental strength. So it's all about optimizing your physical, mental, emotional well-being, and it all goes together, how you can function better when you are happy molecule in your body better. Yeah.
Definitely, you answered the following question because it was, I was going to ask you about that. It's also about when we're having sleep issues. It's also having our libido, there's your sex life. Also, it's being impacted with this.
Mm-hmm.
So this is very important. This is something that it's really helpful. It's like giving you that at the end of the tunnel light that you're like, what else can I do?
Mm-hmm.
Oh, I'm over medicated or under medicated, and it's just as simple as you say. And I like the way you say it, harmony, your hormones,
Yep.
having them in balance. And I want to ask something else, or I want to bring up another subject regarding this. This is, we talk about perimenopause, menopause, and postmenopause,
Mm-hmm.
but also let's talk in general, men and women. We all have estrogens, we all have testosterone, and we all have progesterone. Yes, women, yes, ladies, we have testosterones in our
Mm-hmm.
body. And gentlemen, yes, you have estrogens in our body.
Mm-hmm.
And sometimes we think we don't because we're women, we don't have testosterone. Yes, we do, different levels. Can you elaborate a little more on
Absolutely,
that?
and it's nothing like, I think it's just how testosterone T is male hormone. It's automatically people's assumption that testosterone is the male hormone, estrogen is the female hormone, but it is not. It's just we both have, it's equally important. Testosterone and estrogen, we as a female has them too. In fact, testosterone is our dominant hormone.
Look at that.
So also the male has a testosterone, of course they do, but they also do need estrogen, equally important. The difference is, I'll tell you, difference is we have a testosterone, but male has a 10 times, they need a 10 times higher than we do. That's the difference.
That's
But
the
we both
difference.
have them. They just need a 10 times higher than we do. And it play a huge role. Testosterone plays a role on our energy, joint, cardiovascular, circulation, mood, depression, anxiety, sexual life, and all that. Estrogen helps more with the mood, hair, nail, skin, metabolism. So it all has a different role, but it's really important for both hormone. Similar to the male, they also do need a equally they need a testosterone and estrogen, but when they bring the testosterone level higher or better, optimize their estrogen also getting better. They just don't need it too much. So that's
There we
just the
go. There
difference.
you see it. And doctor, is this is only something for women?
Absolutely not. So it's actually, I be surprised. I actually do pretty equally male and female hormone replacement. In fact, I may have a more male than a female for the hormone balancing, because it's really important. They are coming, the male patient, they're coming to me. I need help with my sleep. I need help with my libido. I want to build my muscles. Can you help me with to run to marathon? So all that they're coming, and the female, same thing. It just they're not speaking much about hormone balance, but it's really equally important. I treat both male and female. We both need a hormone balance, and it's not for only women.
That's why I'm saying we need to have this conversation. We need to open up this conversation to everybody, because it's not only for women, this is also for men.
But the difference is male, female, we usually called they're going through premenopausal or menopause. Male, it's called andropause.
There you go. You go through it too, even if you think. And it's funny because what we hear when women are going through the change, it's like, she's going crazy. Something's going on, or don't talk to her. She's like whole hormonal. She's going. Let's not stereotype. Let's not point fingers, because this is very real. And every person will go through it, even if you're female or male. She just mentioned it. And let's get information. Let's get knowledge. Information is knowledge. Knowledge is power. Be an advocate for yourself. Be an advocate for your loved ones, because you might be doing well, but somebody in your family is not. And after hearing this information, that light bulb may go up, and you say, hold on a second. My husband, my daughter, my mom, my aunt, my friend should be going to the doctor and should be doing this, or at least research. Look for the information, because there's a lot of information out there, but just make sure where you're getting your source of information.
Absolutely. It's very important. There's a lot of stereotypes which you just brought now. It's really, it's easy to point out, like this is what we're going through, but we all go through the hormone imbalance point, whether male or female. Male go through the same thing, but then sometimes it's just like it's a spouse, a couple, you have to understand each other, what good they're going through. And in fact, I do actually a lot of couple therapy.
Isn't that interesting?
I have a male come, and they're like, I need to bring my wife, and then female comes here, and I actually need to bring my husband here. So I do a lot of couple therapy and couple hormone replacement, because it's about a healthy journey. It's about wellness. You want to be healthy, and then start the wellness journey together. We both want to feel better together.
And I love that you mentioned that you're treating couples, because that's awesome. That's great. Because you're going through this journey, you're
together.
Going through this together. You got married in your early 20s, 30s, then you go through life, and then when you hit this wall, it's like, what am I going to do? So you can do this as a couple, and that's incredible that you're doing that.
And it's really important, because you want to be healthy and happy and younger together.
Definitely. So here we got it. Revive Medical Wellness. Thank you for joining us today. And Dr. Sharada, Revive Medical Wellness. You are in Northglenn. Can you give us some more details specifically? And I'm going to put the address and the video so you can guys, and all her information. But you're located in
112th and Huron, right in front of Kaiser. Also, you can follow me on Instagram, Revive Medical Wellness, Revive Medical Wellness Facebook. I also do have a TikTok, not very good on that, but Revive Medical Wellness, I have a TikTok, so it's literally, you can tag the address, but it's Revive Medical Wellness at Northglenn, 112th and Huron. You can visit also website www.revivemedicalwellness.net for more information, and if you want to book a consultation.